Welcome to the BamCam with Jack Burnette and Alison Castellano from RFG Advisory. In this podcast, we explore how life and financial well-being are intertwined. We'll look into areas concerning motivation and attitude, financial planning, investing, and much more. Our goal is to empower you with the information and resources you need to help manage your money and strive towards the life you've always wanted. So sit back, relax, and join us on this journey of uncovering your true self and achieving financial independence.
Hello and welcome to the BamCam podcast with your hosts, Jack Burnette and Alison Castellano. I'm Wendy McConnell. Hi, you two. How are you?
We're good. How are you?
Good, Wendy. Nice to see you.
It is nice to see you guys. So it's always a pleasure. You're always so pleasant and happy, and I love it. So what are we going to be talking about today?
Health insurance.
Oh,
Yeah.
Fun. Okay.
You know, many people do elections for health insurance in the fall. And although this episode will probably air after many people have made those elections, but it's something that can be reviewed, you know, at a later date also as we talk about health insurance. And it's confusing for a lot of people.
It's very confusing. So what exactly does health insurance entail?
Well, mostly health insurance is going to cover, you know, the cost of your basic health care.
Mm-hmm.
But it can come in a lot of different forms and fashions. Most people get their health insurance through their employer, if they're employed. So the employer comes in annually with opportunities to make selections for your health insurance. And so people don't understand what the difference is. You know, what's an HMO? What's a PPO? You know, what's a high deductible plan? And they don't really know. So they ask a friend maybe what you do or whatever, their friend or colleague, and they don't really look at it strategically for what's best for their family or for themselves and making the optimal selection from that standpoint. They're confused. People don't understand really what does it mean when you have deductibles and co-insurance or co-payments or what's the difference between co-insurance and co-payments, things of that aspect. What's network, all that sort of thing. So I think people get confused and they don't realize that they can sometimes, you may want to consult with your financial advisor, or if you don't have a financial advisor, you can certainly consult with us and we can give you some guidance and as to how to go about making these selections.
I know when I was making my selections, when I was teaching, I felt a lot of pressure. They did it like in August when school was starting and we had like a 2-week window, but it was also the busiest time of year because you're getting to know your new students. And it was just so overwhelming trying to make those decisions. And I just really didn't have time to like educate myself on it.
Right.
It was hard.
Yeah. But you did reach out to me when you were teaching, and usually I helped you make what was a good decision.
Yes. So. And then I just kept it the same.
Well, that's usually what happens, but sometimes circumstances change that may warrant making a different selection.
What exactly? You had some abbreviations, some acronyms in there that
There's
I heard. HMO. Can you tell me what an HMO is?
An HMO is a health maintenance organization. Now, what does that mean? It in a very simple terms, you are letting your primary care physician be your gatekeeper. An HMO is as an organization is focused on health care that's delivered within that network of that health maintenance organization. And your primary care physician will be your gatekeeper from that standpoint. So referrals to specialists come through your primary care physician.
Okay.
And and those types of healthcare plans are more focused on wellness and keeping you healthy and from that perspective. And that, that's who you really need to focus on, everything going through your primary care physician when you're working with an HMO. That also means typically your health care must be administered through that network that HMO
Okay,
network.
So it's a little bit more restricted.
Yeah. So it's an emphasis on preventative care, wellness, everything being driven through your primary care physician as your network. You can't just pick up the phone and go straight to a specialist. Everything has to be driven through the primary care doctor.
When I hurt my shoulder, last year, I picked up the phone and called an orthopedist office.
Can't do that in an HMO.
Okay.
Well, you can, but it won't be covered.
Well, I don't want anything not covered.
Correct. Yeah.
Okay. You also mentioned PPO. What is PPO?
A PPO is a preferred provider organization, and a PPO plan offers greater flexibility than an HMO. And you generally, while you still want to have a primary care physician to cover your preventive care and wellness, you don't have to go through your primary care physician for specialists. You can go within your network. It still emphasizes preferred provider. It really is referring to a network of providers. That's the preferred part. So you want to, but you can contact directly specialists within your network as another preferred provider, and you can reach out to your
find them on like an app. Like I know we have an app for our insurance, and I can go and search orthopedist
and and they'll show you all the in-network orthopedists within a certain mile radius of your zip code that you're searching. So, and it allows you to go directly to those specialists from that standpoint. A preferred provider network will cover in-network coverage at one type of coverage, but it will also allow you to go outside your network if you would like.
Okay.
But it may be under less favorable economic terms. In other words, you may have higher costs, you may not have the preferred pricing, or you may have higher deductibles, co-insurance, et cetera, if you go out of network.
Okay.
So you typically will also have an out-of-pocket maximum in a PPO, but it may be a different out-of-pocket maximum for out of network versus in network.
Okay.
So anyway, it gives you greater flexibility than
the
an
HMO. Okay. Right. Now you also mentioned another type of plan, a high deductible.
Correct. And this is typically for people that are generally very healthy. I think often young people can benefit from a high deductible plan. And a high deductible plan means just that. It's got a higher deductible, which is the amount of money you pay out of pocket up front before the insurance kicks in. And you generally, it's paired with what's called an HSA, or health savings account. And an HSA is an account where you can put money in pre-tax as a payroll deduction, or the employer may fund it on your behalf, or it may be a combination of the two. And there's some tax advantage savings in that with that type of plan. And then typically, let's say you reach retirement age and there's money in an HSA.
Yeah.
That can also be converted into a retirement account down the road at retirement. So there's some opportunities from that standpoint. A high deductible plan will be less costly to both the employer and the employee as a payroll deduction. So lower premiums.
Okay.
And so if you're healthy, you don't consume a lot of healthcare resources, that offers perhaps greater flexibility.
Okay.
It would not be advised for someone that has chronic illnesses or a great deal of healthcare resources that they need to consume.
Okay. That's interesting. Well, you mentioned some words that I know I see in my insurance plan a lot, like deductible and co-payment and co-insurance.
Sure. A lot of people don't understand what all that means. A deductible is what that means is basically the amount of money you pay first before insurance kicks in. So let's say a plan has a $1,000 deductible. And it may be, if you have more than one person on a plan,
each person has their own.
So you may have a deductible per person.
Mhm.
You may also have a family out-of-pocket deductible. So
Okay.
in your family, for example, you're a family of 3, you, your husband, and Adrian and Laura. If you're all on the same family plan, which you are right now,
Yes.
you have an individual deductible, and I don't remember what yours is, but let's say it's $1,000. Your family deductible maximum might be $2,000. So it may not be $1,000 per person, but
Yeah.
it might be $2,000 from that perspective. So what that means is you pay that money first before any insurance benefits kick in.
Yeah.
So generally in January, February, you're paying money out of pocket. If you go to the doctor and the bill's $80, you're going to pay all $80 because your deductible has not been met.
Yeah.
So
that's why when I had the MRI on my shoulder, it was quite expensive.
Correct. Yeah. Because your deductible had not been met at that point.
And I went in like February.
Yep. But once it's met, then your insurance benefits come into play. And then you have coinsurance or copays that come into play.
Yeah. So those sound very similar, but they're totally different concepts.
Well,
a
they
copay
both start
or
with
coinsurance.
they both start with the same first 2 letters.
I know.
In simple terms, the difference is one is fixed rate and one is percentage.
Okay.
So a copay means it's a fixed rate that you pay when you have a medical service or procedure administered. A copay, let's say, for example, your plan may call for different copays depending on the type of service.
Yeah.
So let's say a primary care physician copay might be $20.
Okay.
And a specialist copay might be $40.
Yep.
So that's not an uncommon type of thing. Or it may just be $20 for all physician copays. Every plan is different. But a copay is going to be a fixed dollar amount regardless. So it doesn't matter if your service is $60 that you're having done, or if it's $1,000 you're having done, the copay is a fixed dollar amount. It could also be for procedures, could have a different copay. A procedures might be a $50 copay, like an MRI.
Yeah.
But that is a fixed dollar amount. Coinsurance is a part that you pay of each procedure or service, but it's as a percentage. So instead of it being $20 or $40, it might be 20%. So the more expensive that service is,
the more you're going to pay.
The more you're going to pay, because it's going to be a percentage of that service.
Yeah.
And it's common. And for example, Medicare, traditional Medicare, we'll talk about that down in a little bit, is done on a coinsurance perspective.
Yeah.
It's based on a percentage sharing.
Yeah. So basically, copayment, I can know what I'm going to pay when I show up at the doctor's office, but coinsurance, I might not know what I'm going to pay.
Correct.
Until the services are provided. So
you need to understand your plan. You're typically not going to have a plan that has copay and coinsurance. It's going to, you're going to have 2 things to pay attention to: the deductible, and do you have copays or do you have coinsurance?
Yeah.
So that's what you need to understand.
Yeah.
But you're going to have one or the other.
One or the other. So you won't have both. That's good to know.
And then some services may have no copay at all. So for instance, wellness visits often have 0 copay. But I'll throw a little catch into if you go to the doctor for what you think is a checkup and a wellness visit, and you bring up some issue you're having an issue with, say, doctor, I'm also have these sniffles. I feel like I'm coming down with a sinus infection and that sort of thing, even though we're doing a checkup, and then your physician is going to code that service, not as a wellness visit. They're going to code it as generally they have different levels of complexity. So the physician may code it as a level 1 office visit that won't have a 0 copay. And so what you thought was going to be a 0 copay now is going to have a $20 copay.
Yeah.
or 30.
I have learned this about the well visits having a child.
Correct.
Because every time Laura goes for one of her, 12-month checkup or 9-month checkup, that's all no copay.
Mm-hmm.
But when we take her for a sick visit,
yep,
$30.
Absolutely. Yours is 30 for every time. So
yeah. So I don't think I realized that about our health insurance plan until I had a child who was going for more well visits than I go for.
Correct.
Always learning.
Yep.
So, well, let's talk about the Affordable Care Act for a minute.
Okay. People are, this was also known as Obamacare.
Yeah.
Came into effect during the Barack Obama presidential administration. And it was controversial, and it barely passed Congress, I believe by one vote in the House. But what it was designed to do is bring health insurance availability to people that didn't have access to health insurance through their employer or that weren't employed, and to have access to health insurance, and to address the issue of pre-existing conditions where people could be excluded from health care because they had had cancer in the past or had a chronic illness such as diabetes or something of that nature, that insurance companies could not screen against those people.
Yeah.
So it brought some fairness to the marketplace, but it did not reduce cost, which is what part of the what was promised as part of the legislation. It established what's called exchanges, which is basically a health insurance marketplace where people can go online and see what plans are available to them, but they're typically still pretty expensive.
Yeah.
And they're certainly more expensive than plans available through your employer, for the most part, because employers subsidize the premiums when you're working for an employer, and that's part of your benefit package. So when you're the premiums or the cost of the healthcare when you're working are typically lower for the employee because the employer is paying part of that premium.
Yeah.
The ACA or Obamacare also provides for low-income families a greater access to Medicaid, or also in some cases subsidies, actually, where the federal government will pay part of the premium for the health care if you're a low-income person. So let's say a young single person that is working in a low-paying job. So let's say, or is out of work, or just a student, and they're greater than that. And typically parents can cover children up to age 26 on their plans. So let's say someone that's over 26, not employed, still a student, grad student, or something of that nature, they could get care through the Obamacare, through the exchange, and it might be subsidized by the federal government.
Okay.
So from that standpoint.
What's the difference between Medicare and Medicaid? We've talked about a little bit, but
in simple terms, Medicare is for old people like me.
Okay.
And Medicaid is for poor people, which is for the basically care for the indigent and low income and the like. That's an oversimplification. Medicare goes into effect at age 65 for everyone.
Okay. So you don't have a choice. You hit age 65 and you have to enroll in Medicare.
Correct.
Okay.
Except unless you're still employed.
Okay.
And you're under your employer healthcare plan, you can delay that until you are no longer employed.
Okay.
But you have to have access to that. Now, many employer plans, if you're 65, force you to go to Medicare. They don't give you the option.
You off?
They can.
Okay.
So it depends. It's going to be plan to plan. So, and certainly retiree healthcare plans, people that have access to a group healthcare plan in retirement, which is not a whole lot of people in retirement, but some may have access to a retiree healthcare plan. And if that's the case, they almost always will kick you over to Medicare at that point. because it's shifting more of the burden to the federal government than the employer. But Medicare is generally for people 65 and older, and Medicare has several components. Now, another exception to Medicare is if you are disabled, so younger people or people that have renal disease on dialysis or whatever, regardless of age, qualify for Medicare, and the burden is shifted over to the federal government system. Medicare is broken down into several parts.
I've always heard A, B, C, D.
Correct. And so A and B are hospitalization and outpatients and outpatient services, physician services and other non-hospital services. Okay. And that's the basic part of Medicare. Medicare C, Medicare D, because prescriptions are not covered under Medicare. Okay. Medicare D is a prescription drug plan that is outside the insurance for prescription coverage. Okay. That just covers prescriptions. And a Medicare C plan is a comprehensive plan that is called a Medicare Advantage plan, which basically groups everything into a plan. These are plans sold by insurance companies, such as Blue Cross or Humana or United, and there's others. And it's an all-in-one plan, which basically replaces Medicare as the coverage. So everything is processed through that. If you have Medicare, and things get complicated when you turn 65 for health care. It's not as simple as it seems. Traditional Medicare is a co-insurance plan. And so that means that Medicare covers a percentage, typically 80%. Yeah. So if you have hospitalization, let's say an older person has a heart attack. Yeah. And has to have cardiovascular surgery and is in the hospital for a week or 10 days. And the bill could be $200,000 or $300,000 without any problem. Yeah. Well, what's 20% of $300,000? A lot. 60,000. That's the simple math. Yeah. That would be your co-insurance.
And most people getting a bill for $60,000.
It would be a problem. Yeah. Yeah. So you have to, it's reckless to not have what's called a Medicare supplement plan to pair up against Medicare. You just don't want to be naked with just Medicare only. Yeah. From that standpoint, it would be reckless to do so. And particularly the vast majority of healthcare costs in this country, in the United States, are consumed by people 65 and over. Yeah. In fact, I've seen statistics that show that over half of a person's healthcare expenditures occur during their last 12 months of life.
I could believe that.
So it's, and we saw that with my father, who passed away almost a year ago, that, he had several hospitalizations within the last 4 months of his life. Yeah. And it I saw the bills that were pretty high. So you don't want to just have Medicare only. That's not suitable. Many people go with a Medicare Advantage plan, but you can also have a Medicare supplement plan. Okay. A Medicare Advantage plan groups it all. So that covers your A and B and D prescription coverage in one plan. You see these advertised in the fall where we are now on television. We're inundated with television ads for Medicare Advantage plans. These are Part C plans that are all in one that they market, and the benefits and the cost of them vary from plan to plan to plan. It is complex in the strategy. And we often, when we have clients that are getting ready to approach Medicare, you have a lot of strategic decisions there that we can help try to simplify what is a fairly complex decision-making process.
And just some hand-holding and navigating is very helpful.
Correct, because it's foreign and it's different. Another thing is that people think Medicare is free because you on your payroll deduction, You pay Medicare tax. That's coupled with your Social Security tax, which is, it's basically FICA, which is Social Security, and Medicare are coupled together. So everybody pays Medicare into Medicare throughout their working career, and that's matched by your employer as part of that, and paid into Medicare. When you go on Medicare, it's not free. You still have a Medicare premium that you have to pay.
Okay.
On top of that, it is means tested. And you may ask, what does that mean? That the higher your income, the more
higher
you
your
pay.
Premium.
Yes.
Wow. Okay.
So it's a blessing to make more money, obviously, but there's also a curse associated with that.
Yeah.
So to give you an example, when I went on Medicare 2 years ago, anybody that's been following along, most of you know I'm 67 years old. But when I went on Medicare 2 years ago, my actual premium cost for healthcare went up, even though I went on the federal
government.
So my out-of-pocket cost for my healthcare in total went up because the Medicare premium is means tested.
Yeah.
And that's just the way it works. That's the way the law is written, and
nothing you can do about it.
Nothing I can do. I could make less money.
Yeah.
And right now I don't opt to do that.
Well, your cruises would have to go on.
That's right. I'd have to go on a tighter budget if that were the case. So Medicare is kind of complex, and it's something we do a lot of hand holding with clients when people come to those crossroads from that perspective.
Jack, I have a question.
Yes.
I was wondering, since
you're far from 65, Wendy,
since your premium went up when you switched over to Medicare, it's not an option for you to continue with the insurance plan that you already had?
Well, I was not under an employee covered plan. I'm self-employed.
Right.
So I had access to my health care through my wife's coverage, which was a retiree health care plan because my wife retired 5 years ago.
Okay.
So we moved from an employee plan to a retiree plan. And we're blessed that the company she worked for, my wife worked for Pfizer for
over 30 years,
almost 38 years. And Pfizer had great benefits. And so when she retired, we moved from an employee plan to a retiree plan, but we were fortunate to have access to that. So on the retiree plan, I was forced to go to Medicare, and we still have, and they offer their own Medicare Advantage plan that pairs with Medicare, and that's what I do.
But if somebody has a, regular employer based healthcare system plan that they've been, using for the last 20 years, is it an option to stay with that rather than go on Medicare? If
their plan will allow that, yes, it would. And it actually most likely would be preferable to stay on the employee. And sometimes that plan may require you to at least go on Medicare A.
Okay.
But not B. So it's going to depend on that plan and be very specific. So someone that's working and approaching 65 needs to have conversations with their HR department to know exactly what's required of them to continue that coverage. What you don't want ever is a lapse in medical coverage.
Right. Okay, good to know.
Quickly on Medicaid, that's typically for low-income individuals and families. Medicaid is funded. It's basically a joint venture with the federal government
and the state government.
State government.
Yeah.
So the Medicaid plan in every state is going to be a little different, and what's eligible, what the income requirements are is going to vary from state to state. So you'd have to contact, for instance, here in Alabama, the Alabama Medicaid agency to determine what the income limits are as far as eligibility from that standpoint.
Okay. Well, let's talk about things like an EOB, because that's one of the things that I've gotten much better about examining as I've grown up gotten a little wiser,
Mhm.
just understanding my EOB.
An EOB is an explanation of benefits statement.
Mhm.
Your insurance provider, for every service that you receive that's processed and billed to the insurance company, will send you an explanation of benefit statement, commonly referred to as the EOB. It's very important for you to understand how an EOB works. The EOB is going to give you all kinds of information about that particular service. So first, it's going to name the provider. So it's whether it's a physician or a lab or a diagnostic center where you had x-rays or whatever, a hospital or surgery center. It's going to show who the provider is. It's going to show the details of the claim. So it may be multiple claims under that one day of service. So there might be a doctor's visit and then some other type of service also coupled through that goes. It's going to show what the gross charge is, which is going to basically their list price. Your health insurance plan will have a contract price.
Yeah.
So let's say that physician service, the list price might be $150 for that office visit, but the contract price might be $60.
Yeah.
And that is something that insurance companies and the providers are, based on what networks they're part of, negotiate certain prices. So that's called a contractual adjustment. So that'll show up on the EOB that shows gross charge and net allowed charge.
Yep.
And that's important. And that's what your coinsurance and copay is based on. So part of having access to a plan is access to these contract pricing.
Yeah.
So if you didn't have insurance at all, you'd be paying list price on everything. So you want to know what the allowed amount is. It's going to show what the deductible, if that was applied. So early in, say, January, February, or whatever, you go to the doctor, it may show $150 gross charge, $60 allowed charge, and then it's going to show deductible applied $60 because you haven't met the deductible yet.
Yeah.
So, and that's your out-of-pocket cost. So the plan pays zero because the deductible hasn't been met. So once the deductible is met, you're going to have the contract pricing and then the amount the insurance company pays. And then it's going to show the net amount you owe out of pocket.
Okay.
So that's going to be the patient responsibility part. And that's important to match up because what happens, let's say, for example, you didn't pay for anything at the time of service.
Yeah.
So then the provider sends you a bill. And you want to make sure that the bill they send you matches up to what your out-of-pocket responsibility is.
Yeah.
Because you don't want the provider to say, okay, we billed $150, but even though the contracted price was $60 and they paid $40, and your out-of-pocket responsibility is $20, you don't want them to say you owe $110, $150 minus the $40 the insurance paid. So they're not supposed to do that. It's actually illegal for them to try to bill that, but some
medical billing is its own.
Well, and it's complex, and many places that do medical billing, the people that process the billing, it's a volume business and there's mistakes that are made. And so it's on you to understand your EOB, and you should match those up to what the bill is to make sure you're not overpaying. And if not, you need to call the provider and say, wait a minute, my EOB says the contract price is $60, insurance paid $40, I only owe you $20.
Yeah.
And they usually can get that corrected. You know, the EOB is also going to show if you're in network, out of network, and the like.
Yeah. Since we've been talking a little bit about medical billing.
Okay.
Remember Laura had her tube surgery.
Correct. That was just about a month ago.
Yeah. And what was like so crazy, I think it was in August. What was a little crazy is, you know, we paid at the hospital. Then we got a bill from the doctor that did the surgery. Then we got another bill from the hospital. and another bill from the anesthesiologist.
Correct.
And it was just so many bills from so many different places. And what's also crazy is they all came like 2 months at least after her surgery.
Okay.
And then they wanted the payment in like 10 days from the date the bill was printed.
It's almost like it's already past due by the time you receive the bill.
Yeah. I would much rather just pay it all at the time of service.
That can be very frustrating, and it's not uncommon, and it's just a very imperfect system. It's not every provider of service has their own bill that gets processed by the insurance company. So, and then they bill you the net amount from that perspective. When you have something like surgery, there's multiple people involved.
Yeah.
You have a facility. That's the hospital or surgery center that is, and think of it as a physical plant. And it is a facility. It's the OR room. And that's one charge. You're going to have the surgeon, the person that actually does the procedure. And that's the doctor that administers that procedure. They're going to bill, and you're going to have services and an EOB for that. If there's anesthesia involved, you're going to have an anesthesiologist bill, and that's going to be another physician that's involved doing that. There may be lab tests associated with that. So and then there may be a pathologist that is, doing some specialized review of that. There may be, if there's imaging that's done, so let's, for instance, with MRIs and things of that nature, you may have a radiologist that's reading those services. So you can often have multiple medical providers for one procedure that are involved there. And you need to understand how all of those kind of come together. So it can be quite confusing.
Yeah. It just felt like we got one bill after another bill after another bill after another bill, all for the same procedure. And you're thinking,
why are you getting 3 bills for one procedure?
Yeah.
That lasted about 30 minutes.
Oh yeah.
Yeah. So it can be a little confusing and overwhelming. So I hope this is clear as mud.
It probably is clear as mud.
But one thing we've been doing on our podcast is talking about adulting. People that come out of their families and into the real world, living life, don't understand how all this works. And that's one reason why it's often good to have a financial advisor to help you here. And so anyone that's a member of our subscription financial planning process could pick up the phone and call us.
Yeah.
And say, I don't understand this. Why am I getting 2 bills for the same procedure?
Yep.
And we could easily answer that and try to clarify that for them. And that's part of the ongoing service that we would have if you were a subscription member of eaterfinancialwellness.com.
Exactly.
Self-promotion here.
Yes.
Tell them how to get in touch with you directly.
Allison?
You can reach me through email at Alison, ALISON, @eaterfw.com.
And your cell phone?
205-504-9868.
Yes. And my cell phone is 205-613-4994. And it's Jack at eaterfw.com. And that's Eater, ITER. Just as a reminder for folks that eater is the Latin word for journey or pathway. And we would love to be helping you on your pathway to financial wellness.
Well, and I don't know why people get confused with this health insurance stuff. It's so easy and straightforward, right? Did they make it more difficult for you to follow?
It is complex, as many things in life are.
Yes. All right. Good point, Jack. All right. Thank you to both of you, and thank you for listening today. Please like, follow, and share this podcast with your friends. Until next time, I'm Wendy McConnell.
Thank you for listening to the BamCam podcast with Jack Burnette and Alison Castellano from RFG Advisory. Click the follow button to be notified when new episodes become available. Visit our website at rfgadvisorywealth.com/Jack Burnette or give us a call at 205-510-9072. And don't forget to click the follow button to be notified when new episodes become available.
Content here is for illustrative purposes and general information only. It is not legal, tax, or individualized financial advice. nor is it a recommendation to buy, sell, or hold any specific security or engage in any specific trading strategy. Information here may be provided in part by third-party sources. These sources are generally deemed to be reliable. However, neither our guest nor RFG Advisory guarantee the accuracy of third-party sources. The views expressed here are those of our guest. They do not necessarily represent those of RFG Advisory, its employees, or its clients. This commentary should not be regarded as a description of advisory services provided by RFG Advisory or performance returns of any client. The views reflected in the commentary are subject to change at any time without notice. Securities offered by registered representatives of Private Client Services member FINRA SIPC. Advisory services offered by investment advisory representatives of RFG Advisory LLC, RFG Advisory, or RFG, a registered investment advisor. Private Client Services and RFG Advisory are unaffiliated entities. Advisory services are only offered to clients or prospective clients where RFG Advisory and its representatives are properly licensed or exempt from licensure. No advisory services may be rendered by RFG Advisory unless a client agreement is in place. RFG Advisory is an SEC registered investment advisor. SEC registration does not constitute an endorsement of RFG by the Commission, nor does it indicate that RFG or any associated investment advisory representative has attained a particular level of skill or ability.